Our next big topic is the lymphatic system, the tapeik with lymphatic edema. The fluid in the lymph vessels and the lymph nodes form the lymphatic system, which has three important roles. It returns the fluid back to the heart. It helps large molecules to enter the blood system, to get back into the blood system, for example, hormones or lipids. And it has a big role in the immune system. It plays a really big role. The blood in the arteries, when it runs through the arteries, has a high pressure. So fluid gets out of the arteries, and it's important that that fluid gets back into the blood system, which happens in the angulus venosus, behind the clavicula. The little lymph valves in the interstitium have little valves. These valves can open when the pressure is too high. When we use the EpiFlow tape with a lymphatic edema, through the lifting effect of the EpiFlow, we create space underneath the skin, and we create room for the little lymphatic vessels to be able to open and close again, and to help the lymphatic system to drain. We also, by using the EpiFlow, try to lose up little protein-sugar connections which form when there's too much pressure over time in the tissue. The lymphatic system builds little anastomoses, little connections which are normally not so important, but they become important when we try to use them to help to drain a certain area. The body normally gets divided in watersheds. Watersheds are regions where there are less lymphatic vessels. So one lymph node normally drains a certain area of the body. And these little anastomoses are able to cross these watersheds. So this is the point where we use the EpiFlow, that we try to activate these watersheds and these anastomoses crossing the watersheds to help to drain the edema. On the other hand, we see that, let's say, lymph nodes are removed, that the lymph nodes who are still there working can work 10 to 20 times more than usually. The question is just, is that enough, or does the body need support?